Hello, hi, I'm Dr. Parikh from Ascot Family Dental, and I'm gonna go ahead and go over some instructions on how to take care of the area after implants. So, you're getting this video because probably you have recently gotten a dental implant. So, I'm gonna go over some instructions on what to expect and what not. First of all, activity. So, first 24 hours or so, I would have you avoid doing any strenuous activity. That means don't work in the backyard, don't go to the gym first 24 hours. After that, you're okay to do any strenuous activity. And the reason for that is that when you work out, there is a high pumping of blood flow around the wound, and that can cause the clot to dislodge, and that's why we don't want you to do that. Next is discomfort. Expect some discomfort depending on how many implants you're getting and how complicated the surgery was. You expect some discomfort. Most of the procedures that we do, it can be handled with ibuprofen or Tylenol. And the best way to take this kind of pain medicine, we will have given you some instruction as well, but the best way is take ibuprofen 400 milligrams, and then 3 hours later take an extra strength Tylenol. 3 hours later take ibuprofen 400 milligram, and repeat that cycle. So basically you're taking every 3 hours, you're either taking ibuprofen 400 milligrams or extra strength Tylenol. Do that for first 2 days, regardless if it hurts or not. And after the second day, you can go ahead and taper it down depending on how your need is. Infection. There's some chances that you might get an infection around the surgical site, and that's why we would have recommended you or prescribed you some antibiotic. It is important that you take antibiotics without missing a single dose. And if for some reason, I'm sure pharmacists will tell you everything about it, but if for some reason you miss the antibiotic dose, just continue right after. So take antibiotics as prescribed, and it is very important you do that. If you notice a rash, itching, difficulty breathing, or other signs of possible allergic reaction after taking antibiotic, please let our office know. Next, swelling. Expect some swelling after the procedure. After most of the surgical procedure, it is normal to have swelling. The swelling will keep on growing, getting worse. On the third day, it will be at its maximum. After the third day, swelling will gradually keep on going down. In about a week or so, it would have been completely gone. If for some reason the swelling is not getting down or is not completely gone by 10th day, give us a call. What really helps with the swelling is during the first day or two, apply ice pack. Applying ice pack for about 10 to 15 minutes on and 10 to 15 minutes off is a really good procedure by which you can avoid having swelling. So ice pack combined with the pain medication like Advil or Tylenol, that helps reduces the swelling, and your discomfort will also be low. Bleeding. Expect a little bit of blood coming out or oozing out of the wound for first day. Blood is a pretty strong dye, so what happens is a little bit of blood mixed with a lot of saliva makes it feel as if there's a whole bunch of blood in your mouth. But in reality, it's not a whole bunch of blood. It is probably just a little bit of blood mixed with a lot of saliva. But regardless, the best way to control bleeding is pressure. We would have given you some extra pack of gauze. Roll the gauze in small, like couple of folds, make it a small gauze, and bite right on top of the wound. And any kind of pressure will stop the bleeding. So it is really important you apply the pressure at the right spot, and it will control the bleeding. If for some reason you continue bleeding even after doing all these, just give our office a call. Oral hygiene. So continue brushing, flossing just like how you do, except the treated area. All the untreated areas, make sure you do brushing, flossing, keep everything clean. Just on that spot, I don't want you to do anything for first, I would say about a week or so. Smoking. This is perfect time to smoke. Perfect time to smoke. No. This is perfect time to quit smoking. Yes, believe it or not, a lot of our patients have actually quit smoking during this period, and I would highly encourage you to do that. Okay, so this is a good time. Smoking delays the wound healing. Not only it delays the wound healing, but the blood supply that carries all the nutrients to the wound, because of the smoking, it either blocks the nutrients to be carried towards the wound, or it slows down, and because of that the healing is super slow. So smoking is definitely not good during this next 2 weeks or so. Eating and drinking, we want you to eat anything that is soft and cold for first day or two, depending on how many areas were affected. If there's multiple implants that we did, pretty much full arch on the lower jaw or upper jaw, then you should be limited to just liquid diet for about a week or so. If it is just one implant or two implants, just avoid eating on that side. And what happens is you're okay to chew whatever you want to chew on the other side. Just on that treated side, I don't want you to eat anything hard for at least 2 to 3 days. Now after third day, I want you to gradually try to eat a little bit harder. And if you put a little bit harder food on the implant side and you feel like there is still pain or discomfort, I want you to stop and just wait few more days before you start chewing on that side. It is very important that you do not put any pressure on the implant side as long as possible. So the more pressure you put on the implant side, it kind of slows down the healing. Typically, we recommend that after implant is placed, we want you to wait about 3 to 4 months, even sometimes 6 months before we can put a permanent crown on top of it. So during that period, 4 to 6 months, the longer you can avoid putting pressure on that area, the better, because pressure kind of slows down the healing, and in some case, if it is an excessive pressure, the implant might even just come right out of the socket. So be careful. Use of removable dental appliances. So since the tooth is gone, or since the implant surgery and you're missing a tooth, you're okay to wear any kind of removable dental appliances that you have. But again, I would encourage patients during the first month or so, as I said earlier, I want you to avoid putting any pressure on it. If you're wearing removable dental appliance, you're gonna inadvertently put some pressure on that implant area, which can cause some compromise in healing of the implant. So the longer you can avoid wearing any kind of removable dental appliance, it is great. But if you cannot avoid it and you have to wear it, just remember you're not going to put any pressure on that area while you have appliance in your mouth. So avoid eating anything hard on that side. Next is, we would have given you a list of all the food items that you can eat, especially for the patients who are getting multiple implants. It is very important that, I want you to have nutritious food. A lot of patients find helpful during this time to use Vitamix or any kind of grinder to grind and mix all the food and make it into puree format. Probably mix it with yogurt or some kind of juices and make it puree, and then you can have it. So I want you to still have nutritious food, but just make sure it is a liquid format. There are certain milkshakes, protein milkshakes available out there in the market that you can have protein shakes, and that's going to fill you up and at the same time provide you with nutrition, even though you're not chewing or eating anything hard food. The next is, I'm going to go over a couple of instructions specifically for the patients who are getting bone grafting done in the sinus. Now, if you had an implant placement done along with some bone grafting done, especially in the sinus, there are a few things that are specifically for you that you're going to have to keep in mind. First is, we sometimes have to do the bone grafting in the sinus to add some bone or to increase the height of the bone so that implant can be stabilized over there. So do not blow your nose for at least 7 days, as the pressure will delay or damage your sinus healing. So if you're getting bone grafting in the sinuses, I don't want you to kind of put any kind of negative pressure. Some patients like to blow their nose. Just avoid all that. I would have you use any kind of over-the-counter oral decongestant. That means Benadryl, cetirizine, Sudafed, Afrin nasal spray. All those are really good to kind of help you decongestion in the sinus area. Take antibiotics that have been prescribed to you. It is very important for the patients who are getting bone grafting in the sinuses to follow those antibiotic regimen. That's super critical for you guys. Do not drink through the straw. This creates suction, which may damage a healing clot. You may drink out of a cup or a bowl or use a spoon. If you have to sneeze, do not hold it back, just sneeze out. Open your mouth and try to minimize the pressure in your nasal or sinus passages. So I know there's a lot of instructions. I kind of combined a whole bunch for patients who are getting 1 or 2 implant, to the multiple implant, to the bone grafting, to the sinus grafting. So this is kind of a lot of instructions for the patients who are getting different kind of surgery, all combined in one. Again, last but not the least, if you have any questions, give our office a call and one of our assistants or doctor can help you answer your questions. Thank you. Our office phone number is 916-782-3129. Thanks.